But that was actually a very wonderful introduction. And I think if we're being brutally honest, and I guess this is how I envisage, I guess, the future really to some extent, and the UK, I guess, I will talk about who I am in a minute, but the UK, obviously, we have quite a dense population of people where we do still have regular meetings that are held, but because the fancy is dwindling, you're getting to the point, and certainly from my point of view, let's suggest if I was going to come to a meeting to speak, if I go to a meeting to speak and I travel 3 or 4 hours and you turn up and there's 6 people in the meeting and you're like, well, it's not exactly a very efficient way of doing things. And so it is difficult getting speakers, whereas this sort of setup, which works brilliantly. I mean, obviously during COVID, all the meetings I've been doing have been solely on Zoom primarily. The actual merging of the two, where you've got, people that can attend the meeting in the meeting, which is great, and they can chat with their friends and do what they want to do, but you can open this out to a bigger audience, particularly, I guess, for you guys. And obviously, I'm assuming your demographic, and there's lots of space between you guys to get to meetings. For me, this is the way forward. It makes the meeting more economical. This meeting's being recorded. This means for the guys that can't get here, you've got it recorded. And the number of meetings I've been to over the years, and I've been keeping budgies since I was about, 13, 14. I started with ducks, then got into soft bills for a bit, Asian African soft bills mostly. But and the budgies were first just for earning some money to pay for the live food, if that makes sense. But the fact of the matter is now is you've got these as a permanent resource. The number of meetings I went to, and you're like, what did they say last month or the month before? And then these sort of tales get distorted as they go through. Whereas having a resource such as you can go put this onto your website, log into it, and go, oh, what's said then? Or let's go back and have a little think about that. And you've got that as a resource. So this is the way forward. I think for education, for knowledge transfer, and for opening out your meetings to more people. Zoom subscriptions aren't that much money, to be honest. They're far less than the meeting hall is going to cost you. But it does open the world right out. So thank you very much for inviting me to it. I'm loving the fact that I got a view of, I would say, the expected demographic of budgie breeders primarily. I'm jealous of some of the facial hair, it's got to be said. But other than that, yeah, you're laughing now. But other than that, it's great. So about me, I've kept birds, like I say, since I was a teenager, with my parents, with my dad and my mother, mostly rare varieties as it happens. Then I went to vet school, graduated from vet school in 1995. So that's quite some time ago. I'd like a sandwich. Is that a sandwich going? I've missed the sandwiches. It's all right. It's okay. It's not lunchtime yet over here, so we're good to. It's all right. We're good to go for another hour. So anyway, so went to vet school, and obviously then took a back seat on the budgies. And my parents were still breeding them. We were breeding all sorts of varieties. So we had, I guess, Spangles when they first hit the UK. We had those. We had TCBs when they first hit the UK. Breeders of Cress. We had some slates knocking about. Recessive Pieds. Continental clear flights, dark-eyed clears, plus all of the standard colours. And then when the Australian yellow face hit, which we now call golden face, I guess, we had those as well in our recessive pies, which were beautiful. That was back in the sort of, 2000s almost. But obviously having taken off to a career to the side, I had to take a back seat. I've been moving around the country a bit and ended up in Scotland, basically, where I'm now head of a specialist referral service. I'm a specialist recognised by the Royal College, which I guess is our UK governing body. I've been a specialist for 16 years in the UK, but I'm also recognised as a specialist by the European College as well. So I'm basically a triple boarded specialist now. And my dad, bless him, got hit with a brain tumour quite fast, to be honest, and bless his cotton sock, sort of demise very quickly over an 8-month period. And at this time point, I went down and I'd sorted out the birds and cut the numbers back down. And obviously he was incapable of looking after them, and so was my mother. And I was like, I don't really want to let these birds go, because I've been showing them as a kid, you know, the crested and the recessipides and the clear flights we got, for example, and even some of the spangle families. I can trace them back to when I was a teenager 30 years ago. You know, this actually is for me is a legacy thing in part. And so when I rejoined I guess the National UK Society, to find that the hobby in the UK had contracted by about 90% in the last 30 years, it was just appalling, to be honest, the rate at which it had collapsed. And I guess in combination with the bunch of old wives' tales going around, meetings weren't attended, shows were just non-existent, and the ones that were continuing were really struggling financially, and numbers on the benches were appalling. I was like, my dad wouldn't really want this. So that's kind of when COVID hit that I went, well, actually, I can be of help to people here. And I started doing the Zoom meetings, and I found a club in the UK that was quite keen. We did some bits and pieces, but it was always going to be, I guess, a local club. And I guess what I wanted to do, well, my legacy, I guess, was I wanted to open out the budgie fancy more worldwide and improve education and knowledge transfer for people. And when that sort of local club had reached the sort of point that it just wasn't really working as it should do, then this new national society is formed. And much as it's UK based, the fact of the matter is you know, that we're trying to make this as wide an appeal as possible. And I'm putting a lot of work into getting knowledge transfer over. So that's pretty much it. I've got a presentation that I'm going to go through with you. So I'll share my screen for a PowerPoint. And Troy and Chris, I mean, I'm happy for questions at any time point. You're just going to have to wave at me because I won't see the chat when I'm screen sharing. But beyond that, if you're happy, I'll go through it, and any questions you've got on anything, just ask and I will answer them. Let's just find the right bit to screen share. Okay, so let's do that. Right, so you should have that full screen on your monitor now. And I think it's probably about an hour. I might start looking. I've got two screens, so if you see me 3/4 view on my best side, that's because I'm looking at the screen on the slides that are coming up, and where I've got to hit. So it's sort of on a presentation view here. So we're going to talk about budgie diseases and treatment. This is a general sort of overview for you that we're starting off with. And I suppose that the first thing when we're looking at this is, okay, I need to know when my birds are sick. Now, we're all experienced fanciers, some maybe not be, and obviously there's loads of people in the pet market, I guess, who are breeding birds that maybe aren't members of the bigger exhibition societies, which obviously is a massive population of people that are lacking education as well there, I guess. But we know budgies have a high metabolic rate. They're going to lose their heat quickly. So if we chill them, then the metabolic rate is elevated further. And certainly depending on, again, climatic conditions of where you are, you know, if overnight temperatures are dropping, that's a big concern. They need to eat and they need to drink continuously. And what you tend to find then is, from people seeking veterinary help, normally it's like, oh, the cat hasn't eaten for a day or two, or I'll take it to the vet. You know, from a pet owner's, from small owners' point of view with small numbers, it's like, well, they're still feeding. It's like, if they don't, they're dead. I mean, literally, if this bird stops eating, it will die. So when we're looking at treating a sick bird, we've got to think about heat. We've got to think about food provision. We've got to think about water provision, because if I put these things under stress, that makes that sick bird sicker, to be honest with you. And this is what budgies do. It's that sort of thing of, I'm fine, nothing's wrong with me, I'm perfectly fine, oh, I appear to be dead. You know, your literally time scale you've got from spotting it's ill to being dead can be quite fast. And if I stop eating, I'm going to die. So I've got to eat, even if I'm critically ill. I'm going to keep feeding. And I'm just going to pretend I'm fine, because that's how I survive as a prey animal. And as a flock animal, I want to have an even chance, the same as everybody else. So I guess the first thing for me, and this is my dad's old shed on the left here, actually, but do a head count. Do that twice a day. When you're opening the shed in the morning, do a head count. If you know you've got 50 birds in that flight, count to 50. And if you can't find number 50, well, number 50 is in there somewhere. And number 50 is probably on the floor, off to one side, hiding behind the seed bin, like I've highlighted on that picture. That's where number 50 is likely to be, lurking down there. So if you're counting your numbers and you cannot find that bird, hunt for it, because it'll be on the floor somewhere, grounded in a corner, hiding somewhere. Right-hand side of my birds in their breeding setup, moving forward, I guess, gosh, probably a good couple of decades now. But obviously, if you're breeding birds, look in the nest box. If you're going to check your hens and the hen's reluctant to get out the nest box, maybe it's a box on the top and you can't see in from above, which, you know, will be the case with a lot of people. Look at that hen, get her out of the box, make sure she's okay. That's where they're going to be. And obviously, that's the first thing you've got to do, is find where this individual is. And then the next thing, the main, which you will all do, and I've heard it repetitively over the years. Oh, it's not sick, it's just molting heavy. It's Buster Quill. It's just old, it's one in retirement, or it's just finished rearing a bunch of babies. There's a whole bunch of reasons that you could wish away this bird's life, to be honest. Is like, yes, okay, that might be a reason. I don't care about that. This bird is clearly struggling, coping as part of that flock, whatever reason you'd like to ascribe to it, or guess is wrong with it, it's struggling within that group. Get it out, put it in isolation. You have to have physically handled the bird now, and you're capable of telling if a bird is thin or fat. Not when it's looking at it in the flight, but when you put it in your hands and you feel the keel, and the lower picture here obviously is a bird that's lost body weight, you'll go, oh, I wasn't expecting it to be thin. Get it in a cage, feed it lovely food that it likes. And if that's millet sprays or groats or whatever you're doing, if you give it something that it likes, that bird should go, oh, thank God, I just needed some respite care. I just needed to get out because, you know what, those big grey greens are being mean to me, and I'm a wonderful amethyst white cap, and they were just too big and they were just being bullies. Now you can feed it and go, you okay? Is it eating? Okay, it will be eating, but, you know, is it eating normally? Is the feces coming through normally? Or is there signs that it's vomiting? Or is the body condition being improving? You can assess and look at that bird. Now, a bird that is just molting, finished rearing chicks, all of these things that you're going to wish away on, well, that bird should gain weight, shouldn't it? I mean, if that bird is having loads of groats and millet sprays and soft food and God knows what else, and it's in a cage on its own, removed from competition, that bird should gain weight. It should improve. It should be much happier. If it's great and it bounces back and you go, oh, okay, bird's all right, gained weight, I'll put it back in the flight now. My bad. Or, you know, maybe you just needed some respite care. You've had that, you feel better, great. But if your bird isn't doing that, then you are right to remove it, because this bird is not just struggling because of competition or because of circumstances. This bird is struggling because it's sick. And I've just put a bird in here, for example, classical sort of bird here with a kidney tumor, where they get nerves, sort of pins and needles in their leg, as it were, and they have to rest the legs forwards on the perch. And this is always how these sort of present. So weight's important. And I don't think we're going to be weighing our birds on a regular basis necessarily. That would be crazy. But I guess if you do have some kitchen scales and you've got a sick bird, then yeah, you could monitor its weight. That wouldn't be a bad thing to do. Certainly from a clinical point of view, for an inpatient, then we're weighing birds twice a day as standard. And what your bird will do is it will gain weight during the day as it's feeding. You'll then obviously, it'll, you know, go to sleep overnight, as all birds would do, and then it loses weight by the following morning. There is a daily cycle in the weight. And I guess from a clinical perspective, what I want is that bird to weigh more tomorrow morning than it did this morning. So I know that my treatment, my supportive care that I'm giving, my TLC is working, and that bird is gaining a bit of body weight. Now, that might not be body condition yet. That might be food in the crop or fluid in the crop or in the GI tract that wasn't there yesterday because I wasn't sustaining myself adequately. I was trying, I was feeding, but I wasn't capable of sustaining myself adequately. And with your help and support, I've managed to do that, and we might see that with a weight change. So if you have a bird, let's say, that's going from empty to full, you're going to get quite a dramatic weight change. Okay, maybe 1 or 2 grams, maybe 3 or 4, depending on how bad the situation is. But you're going to get a little bit of a jump in weight because the bird now has a full GI tract and it's hydrated. Brilliant, because I wasn't when you found me. Once you've done that, you're not necessarily going to see a dramatic weight change because that bird's going to be at a status quo on a level plane now. It might progressively gain condition, but you're not going to notice a dramatic change day on day. But what you will notice if you stop supportive feeding that bird and say, okay, you're on your own now, I've helped you, kickstart you, off you go, let's see what you do. If that bird's weight drops back again, it's clearly not able to sustain itself yet. It needs more help from you to do that. This is just our setup that we have in the clinic. Like I said, we're in a specialist referral clinic here. We have a little special bird booth for them. These have heat plates on the side, which is lovely for them. They can sit in their own budgie cage, so it's not strange or different for the bird. They've got UV on them as standard, which obviously is one of the things that I'm very enthusiastic for the birds. And there's actually a negative pressure ventilated as well. So all the air that comes into these units is from the room and is vented out the back. So there's no cross-contamination of feather dust. And we can nebulize and we can give them oxygen and all sorts of things. And so it's, you know, these are nice units to have from a clinical perspective. And I guess if your bird is sick and you want it to feed, there's 2 things about having tasty food. It's got to be easy. So the budgie on the right here, we've chucked a load on the floor. It's right there where the bird wants it. It's got its familiar drinker as well, one of the horrible fountains on the side for it there, but it has that too. This one, I think we'll all be happy, is poorly sick, has also come into the clinic. I'm not a fan of honey bars. I'm not suggesting this is anything you should be feeding at all. But the fact of the matter is it's right there. If this bird wants to eat something, it doesn't even have to move. Okay. Millet sprays are obviously a winner for supportive nutrition as well. They will take them as readily. So supportive nutrition and fluids is the first thing that we've got to get on board for a sick bird, and this is a critical part of care. And most of the medications we're going to want to give, well, they're deeply unpleasant, and the bird is going to try and regurgitate them when you give them to them, so we have to be aware of that. So I would be recommending you use electrolytes or liquid diets to dilute any medications you're giving, which reduces the chance of them vomiting it up, but in addition you're rehydrating, or you're giving some calories as well. So basically the first thing you need to do is crop feed your birds. Learn how to crop feed, get a more experienced fancier to help you if you're struggling. But this is how you're going to get medication in. This is how you're going to get fluids in. This is how you're going to get calories into that sick bird. And this really is the one technique, is the one take-home message is, if you're not doing this, learn now. The crop basically is a storage organ, and in babies it can take up to quite a massive percentage of their body weight, and you'll see that when you're breeding the birds. You'll see it in their crops. The sicker you are, the greater the risk you've got of regurgitating, and what you don't want to do is the bird to aspirate and inhale that. So maybe you're down to 1 to 2% of body weight. So for Mr. or Mrs. Average Budgie, you might be going, if you're really sick, maybe I'll give you half a mil. You might take a mil. Maybe if you're really good and deft at this and the bird isn't regurgitating or vomiting, maybe you'll get a couple of mils into it, maybe a bit more. But it does depend on the size of the bird and how good you are at the technique. This one here that's reached, again, come into the clinic, and it's coming in this sort of state, and you're like, I've got to be really careful how I'm going to feed you, because you're going to risk inhaling this. It may make the situation worse. I guess in my circumstance, the advantage I've got is I can, give it fluids by injection and do other things to that bird to support it. But if you find the bird in this state, you're on a loser from the starting point. This bird needs quite intensive supportive care. And so you do need somewhere that is warm for this bird to go. I'm not a great fan of hospital cages per se, because there's no real ventilation in them, and you're forcing them to be in a heat source. I actually quite like having like a pig lamp, so sort of like an infrared pig lamp or a ceramic bulb off to one side, that the birds can choose the temperature they'd like to be at. With a bird that's this sick, however, it can't choose. It's not capable of choosing anymore. It's just going to sit in the heap wherever it happens to be. And then I do have to decide what temperature I want you to be at. And the little unit this bird is sitting in is quite nice. This is a plant propagator. This you'll get from just basically a garden centre. This is where you're going to plant your seeds in to grow and sprout initially. And these little units, actually, you'll get them for, okay, I'm going to be in pounds, I'm incredibly sorry, but you're going to get them for 15, 20 quid. You're going to have to translate that across to Australian dollars. But these, if you switch them on, the base of this unit gets to about 28 degrees. I mean, just, a nice sort of warm bedding area for them, not too hot, but enough to give them thermal support. And so for a bird that has collapsed down on it, it's quite nice without the risk of burning that individual. So these are quite nice. You've got vents in the top of these units as well so you can get some air change through. But for those guys that are really sick, this is quite nice because you can clean it. It's easy to disinfect. I can nebulize in here. I can do all sorts of stuff. I can watch the bird closely. In a lot of the hospital cages, they just turn into this sweaty, unpleasant mess that mists up and a nightmare to clean because you can't clean between birds. So crop tubing, you're going to want to get some crop needles for that. I actually prefer the straight ones for the budgies. I prefer this sort of style across there, but again, it's up to each to his own. For the students, actually, I primarily use the curved ones because it's easier to feel the end of your crop tube to know you're in the right place. But with a budgie, the size crop tube you want is too big to accidentally intubate it, if that makes sense. Once you start creeping up to birds over 100 grams, so if you're going to be looking at things like oh gosh, do you call them golden mantle rosellas? Or they're eastern rosellas, aren't they, the GMRs in Australia? But you get to that sort of size, you start to get to they are eastern, western? I don't know. That's very bad of me. But, you're getting to the point that this could go in the trachea. But for a budgie, you'd need to have some sort of miracle to inadvertently intubate it with a crop tube, to be honest. Okay. Crop tubing, I tend to do them single-handed. What you can't quite see on the picture on the left here is I've got a lower finger, and okay, I'm left-handed, so this is my right hand, so my apologies. I crop do everything backwards to right-handed people. But when I've got them in the crop tube, the lower fingers here, I'm palpating that in the crop. I've got it all in position. The bird's held back of head more than round the throat, so I don't want to restrict that. I'm palpating the crop tube with my little finger. I can't see that with my little finger there. I know I'm in the right place and I can instill the material. So you're safe as houses. And it's just a cadaver on the right hand side with the straight tube here. But obviously you've got the crop tube and you've got the trachea off to the side there. And for supportive nutrition, just get a hand rearing product. I mean, these sort of products like the NutriBird, these have been used for decades and decades and decades for hand rearing citizens of all shapes and sizes. So if you want to get balanced nutrition into this sick bird, well, this will do it for you. And to be honest, those of you that are used to crop tubing will probably be giving supportive nutrition to some of your babies as well when the parents are struggling or aren't doing so well. So you're going to have this stuff knocking about anyway. And there's loads of brands. There's loads and loads of brands. This is just one that, like I say, one of many. I don't have any preference over any of them, to be honest. If you actually look at the nutritional analysis of these products, they're all the same. They're pretty much exactly the same. I don't care which one you use, just use one of them. Okay, that's the first little bit done. What I thought we would go through now for you is just a little overview of some of the common diseases and presentations in budgies. Now, the one that I'm going to be missing here, which I suspect it is, and I'd love to get your views on it actually, but we don't have coccidiosis as an issue in the UK. I mean, we see it once in a blue moon. It's just something that we don't see. But from what I understand, it is more of an issue for you guys. So I'm not covering coccidiosis simply because it's not a common disease in the UK, but obviously I know the demographic might be different in terms of what diseases you guys see. So first on the list is scaly face. Gosh, this has been around like forever. You know, it's very commonly seen. These might spend a 3-week cycle on the birds, and basically it feeds on the protein that makes up the beak. And this is classical sort of appearances that you're going to get. Looks like a duck, quacks like a duck. You've probably got a duck for these. And to be honest, because this is mostly on the birds, this shouldn't really be something that we're seeing anymore these days. It's easy to control. The trouble you've got is subclinical birds coming through, not showing signs, that aren't being prophylactically treated prior to entry to your hut or entry to the pet trade, for example. And then obviously from a pet point of view, we see people presenting birds with scaly face that might be owned 2, 3, 4 months ago, and that's the length of time before they started showing clinical signs. And obviously this is just one that's a bit more severe now, where you can get a lot of changes and distortion to the beak on these birds. So this is something that really, if you're good at your preventative medicine and you've got the plans in place, you shouldn't be seeing scaly face in your birds. Now, red mite is the next one. I'm assuming you guys have potentially quite a lot of hell with red mite, to be honest. Red mite basically is Demonosus gallinae. All wild birds will carry it. Okay, so we've got it on chickens in the UK because chickens love having it. Wild birds have it as well. So things like, I'm stuck with bird species now, but we have house martins, swifts and swallows, for example, that will nest in the eaves of buildings. You know, I've had customers who have had red mites come in and start biting them when they're sleeping in their beds because it's creeping off the house martins from the eaves, for example, which is quite frustrating. Even had red mites come in and infesting African pygmy hedgehogs for the same reason. They've come off the bird and they've run onto the hedgehog for a bit of a fun as well. Now in the UK, our birds are primarily housed inside. Not sure about you guys. Obviously, you've got lots of natural citizens around if your birds are outside too. But certainly for inside house birds, your risk from getting it from wildlife is very reduced. And so from our point of view, our risk factors are, well, I've brought a bird in, or I've used shed transport to and from a show, or I've been and I bought somebody had some nest boxes that were going cheap, and I thought, oh, well, yeah, I'll have those, that sort of type thing. Or I've been to the pet shop where I've got birds that are housed in the pet shop and in the same airspace, in the same environment. That's where they've got their seed, their drinkers, their whatever you've got. And basically you've got the potential of buying contaminated dry stock from the livestock because they're in the same room of the pet shop. And ideally what you want is to basically, if you're going to buy stuff, is have it from somewhere that doesn't have birds in the same room, that is kept completely separate. And for a small pet shop, obviously that's not going to be the case. But your red mites, they love sucking blood and they live in the environment as well. So this is environmental control here now, as well as bird control that's needed. They breed when the temperature's over 10 degrees, basically, and you guys are going to be over that temperature quite a lot of the time. Warmth and humidity, cycle starts increasing, and they can massively, massively replicate in a very, very short space of time. And equally, the mites can live for 6 to 8 months without feeding. So you've got something that can grow massively, but equally will sit in a shed dormant or on things from one season to the next. So this is environmental control needed here, as well as treating the birds. And this is one of my nest boxes, to be honest. When I came to get my birds from my dad, vision on my parents are both obviously demised a bit, so I was organising for them to go to a couple of the breeders and sorting them through. And obviously part of what I ended up having to do at that time was to I guess have a policy on culling, but literally there was just red mite riddled through the whole lot, and scaly face and all sorts of stuff, and it was like quite a major change in the way they were being looked after that needed to be done to bring the birds forward in terms of their health at that time. But this is the sort of thing you're set up with. So these are irritating, they cause anemia, they cause a significant problem in the nestlings. And to be honest, there's lots of ways around you can do this. For me, this is a major debilitating disease. You want something that's going to work, and you know is going to work, to be effective to eliminate it, because you don't want this. Now, I get if your birds are outside, I get if your birds have lots of wood in the shed, I get if it's chickens you've got, that it is difficult to eliminate that because you've got a wild bird reservoir there. But if you're housing them indoors, well, you can stop the red mite. You've just got to have a very effective method of doing that and be regimented in your control. So Ivermectin is the go-to. It works, to be honest with you. There's loads of products out there. I prefer the topical spot on simply because I know I have given you that dose. You have a dose that I know is effective and it is there. I'm not thinking of, did you drink enough? Did you not drink enough? I like to spot on them, and that's it, done and dusted. And basically you want diluted ivermectin in propylene glycol specifically for the purpose on there. And you can actually make this stuff up yourself if you want to, or you buy the products that are all commercially made, really. But for me, I would be using ivermectin spot on for them. And you know, this is just one of the brands for that. And like I say, in today I can't go through everything in massive detail, but get some ivermectin, spot on your birds. And I tend to do 2 weeks apart for any new arrivals coming in. Probably then I would be doing it annually. And if anybody's coming back from a show, you're treated as well back from that show, and you're put in isolation until I'm happy that they are clear. So nobody enters my bird shed without having had ivermectin beforehand. So I would put this on at the point of sale. You know, if I went to a breeder and I was getting a bird, it would be popped on the back of that bird as it entered my show cage or my carry cage before it came home. Okay, Psittacosis is next on your list. This is one that, well, all budgies probably have it, to be honest. But there are circumstances where we see this as a clinical entity. Can go to people, so we need to be aware of that. And a lot of birds will just carry it. And then stress, overcrowding, air hygiene, breeding, this sort of type thing, or relocation. You can get this coming out as an acute outbreak to some extent, as well as a chronic disease. And your classical signs you're going to get here are going to be nasal discharges, to be honest, this sort of type thing. And these are 2 more cases here. And sometimes they're not necessarily overtly obvious signs, but you're getting a nasal discharge around the cere of the bird. Maybe it might be drying up. And certainly, even if you can't see a discharge, I run my finger across the end of these. If you're feeling it's damp across there, or you've got damp feathers matted just above the cere, even if you can't see a nasal discharge at the time, which we've got with the grey hen on the right here, per se, I know you've been discharging because I can see around that and I might feel some dampness. So you're going to get respiratory signs. You're going to get conjunctivitis and sore eyes as well, nasal discharges, green watery poo, and it's in all budgies. And certainly from a clinical point of view, it's so common that some vets that you're dealing with will screen all birds for psittacosis before they even let them in the building, as it were, because it's that common. I'm less obsessed by it, I have to be honest, but some clinics are, because this can pass to people and can cause mortality. Has a lovely little life cycle. We don't need to go into too much details here, but it's the elementary body that runs around that is the infectious agent. That's the bit that we've got to be controlling here. Within the bird, okay, we can treat the bird itself, but it's the infectious environmental agent we need to be controlling too. And you can get clinical signs within 3 days or never. So this is where we get to that virulent form with an acute outbreak versus I get a few of them with snotty nose appearing month on month on month, and maybe failing to control it. The main issue with chlamydia really is it's aerosolized, and so this is dried feces that are produced into the air that the birds will then acquire by inhalation or ingestion. They'll also be spread in if they've got a snotty nose through that as well. Vertical transmission through the egg is possible, not really a thing. This is bird to bird that we're concerned about here. The trouble we've got with chlamydia is if it's a contaminated environment, it will sit there for a month after and still be viable. So if you're treating your birds and you're not cleaning the environment accordingly, well, there's infective material that's sitting there that they can re-pick up again after you finish treatment. And even on a spotlessly clean surface, it'll survive for a fortnight. Even if it's spotlessly clean with no debris on there, it will still be around for a fortnight. So this is a bacteria that lives intracellular by the way that it replicates. Your normal antibiotics do not work. I tend not to be encouraging prophylactic treatment for chlamydia. I know some people do, but I'm concerned about resistant strains and effective treatments and things like that. So I don't tend to recommend it routinely. Treatment of choice is doxycycline. And you can get doxycycline in a whole variety of formats online, rightly or wrongly, and we've got 4 grams of powder at the top here. We've got 10% bottom right. We've got 20% in the middle. Okay, most of these are continental European brands, of course, but you can get them from all over the place, which is great. Okay, I've got to treat my birds anyway. What I actually want to make a little point of here, and I guess this is why you need veterinary input into the treatment of your birds, is if we actually look at the science behind and say, okay, is doxycycline in the water effective against psittacosis in budgies? Not talking citizens generally here, not talking pigeons. I'm talking, is it effective in budgies on an individual trial looking at that? And basically, well, it's not really, is the answer. At 400 mgs doxycycline per litre, so this is milligrams of active drug now, not how much powder do I add, but how many milligrams of active drug, then we know the 400 milligrams is variable. Some does work, some doesn't. This, however, is a dose that is considerably different to the dose you need for a cockatiel, considerably different to the dose you need for a pigeon. So if I go back and I go, oh, I'm going to buy a pigeon product, you go, oh, I don't know what dose to use. If I use the dose that's on the packaging for this, I am massively underdosing my budgies. I am inciting resistance and will have most certainly get a treatment failure because I'm not using the right dose. The only way you use the right dose is by knowing what that dose is and knowing how concentrated that product is. So you need to know the difference. What's the difference between 20% product, to 10% product, to 5% product? I need to know what that difference means so I can put the right amount in the right amount of water to get the right concentration for the right duration of treatment. And maybe I've got to think about impact of light. Maybe I've got to think about the impact of calcium as well on these products. And for those of you that are using other tetracyclines, stop, because they're pointless and useless. And I don't care which fancier says use terramycin paste or who is using CCC. Please just stop using those pointless products. Those tetracyclines are not as effective as doxycycline. there's no indication for using them whatsoever. They do not work. Doxycycline is far better, and it's far better for two reasons. One, it goes through cycling through the liver more, which means it lasts for longer. And two, it's not as affected by calcium. And three, it's got better distribution in the body as well. So basically, you need some science behind to do right for treating your birds. If you're individually treating, what we actually use as well is we actually use dispersible tablets, which works very well. Good for rats with pneumonia as well for that reason. But we've got these that will disperse in water, so you can actually directly crop tube them with a dispersible tablet to get a dose put once a day for the birds that are showing clinical signs. In this picture, actually, you can see my finger checking the crop tube is in the right place there as we're doing it. And that is my hand. Yes, it is me. It is my hand. Okay, next quick run through on diseases. Avian gastric yeast. Obviously, this is a major thing here. Tends to be birds over 8 months of age. Regurgitation or vomiting, I describe these more as a reflux of gastric contents into the crop more than vomiting, where they're sort of trying to swallow, but they're not quite succeeding. And they'll be hungry and they'll have some weight loss. No real diarrhea, but they will pass whole seeds too. And it takes a while to develop. And obviously this is something you guys have, I know, quite a lot too. And basically you want to smear from here where the red arrow is, and we're going to be looking on cytology on these guys for the Macrorhabdus or the avian gastric yeast that we see. You can look at feces, which you can do routinely, which I would do for any sick bird presenting in the clinic, I guess. Question is, do you find it or not? What actually has been quite recently shown, and I'm not sure if you guys have access to it because we don't yet, but there now is a PCR for avian gastric yeast, which is in the States they are using, which is more sensitive than the fecal cytology, but it's like we haven't got it in the UK yet. But there are some labs that are starting, so that might be a new innovation that would be great for picking up subtle cases. It's a genuine fungal infection. We need amphotericin B to deal with it. But the amphotericin isn't really any used for thrush anymore. So in the UK, we used to have a bunch of products that we use, which was great. But basically amphotericin B now has gone out of favour. So in the UK, the only preparation we can actually get at the minute is a lozenge for human use, but it doesn't compound too well if you're crushing it to try and get it into a crop tube. And the IV prep is nephrotoxic, so damages the kidneys of no use either. That said, a friend of mine has just found an oral amphotericin in continental Europe that he bought in, because he used to use the Vetafarm product for years, which obviously we can't get at the minute. Not sure if you guys can, but certainly we can't get it in the UK. But he's actually found a product on the continent, which he's just sent me a sample of, actually, which I've got sitting at home, which I'm going to have a play around with, but very low volume. But again, it's that whole thing of how effective it's going to be. But we always used to use the Vetafarm products when we could get it. But for us, getting a 40-gram tub in the UK, and I suppose the last time I used this was probably, my birds did have a run through actually when I first got them back in 2018. So it would have been 2018, I think, the last time we used Megabac. I mean, we were paying about 120 quid for for a 40-gram tub. I mean, it was just absolutely crazy. That said, when you're looking at other options, then we know that an acidic environment in the water helps control it. And we know that a lot of the fungistatic food additives work. This is a paper, 2014 paper here, showing that sodium benzoate works. You can go onto Amazon, you can get sodium benzoate. I tend to go for 1 gram per litre, and I do it for a month, to be honest, over the summer when they're not breeding. I do worry about people using up to 5 grams per litre, because that's what people do. They just say, oh, it's a teaspoon to a litre. And you're like, yeah, that's a bit more concerning. The paper actually saying 1 gram per month. And it's basically a food additive. You just order it and you dissolve it and off you go. And it's cheap as chips, to be honest. A lot of people use F10 as well. I've heard of people using hydrogen peroxide and other products too. But I guess there is some science behind the sodium benzoate, other acidifying agents. You're just acidifying the water. Again, it will have activity. But I'm not such a great fan of in-water treatment, if that makes sense. Generally, generically, because of tainting the water and wanting the birds to drink as much as they would want. So for me, I wouldn't be running treatment for Macrorhabdus as a continuous thing. I do it at a set time period and say, okay, I'm going to do it now. But then during the breeding season, obviously, I will be stopping all treatment. For the megabacteria, basically, it's not vertically transmitted. You can eliminate it. You just have to incubate your eggs and transfer them somewhere else. This is a disease that could be completely eliminated, but obviously the practicalities may limit that. But I have been through this process before many years ago, alongside amphotericin, to completely eradicate it from a set of birds. The trouble is everybody has it. So as soon as you go to a show, as soon as your birds go somewhere else, you get a bird from somebody else, it comes back again. You know, it's one of these diseases that we all have. And for me, sodium benzoate is a very, very easy way of controlling. The next one used to be a major issue in the UK, actually, but I think it is having a resurgence, really, is Trichomonas. So this is protozoal, this lives in their crop. This is where you get the genuine vomiting and regurgitation, but you do get weight loss with this. Direct contact from bird to bird, dies very easily in the environment, but obviously contaminated water will be a route of transmission as well. And they can carry it up to a year. And basically there's sort of, it lives in the crop, it can cyst up within there, and it can rapidly multiply as well. But when they're passed out of the host, they die. They're easy to kill off, this one, so the environmental control isn't needed. I guess what concerns me, I'm seeing more and more of these cases that are presenting as a rapid trichomonas, where we're seeing birds that I'm fine one day and literally within 3-4 days, they're dead. I mean, it is, you know, that dramatically quick, the rate at which the infection is taking hold in these. So although a lot of people are routinely treating with ranitazole for this, because that isn't eliminating it, you're still getting birds that are breaking through that into acute mortality. And people going, well, I treated for it last week, I treated for it last month, why is it a problem again now? And you're still seeing these cases coming through. From a clinical point of view, crop wash, dead simple. Okay, and you just aspirate, you're basically doing you're doing a crop feed in reverse, in that we would instill sterile saline into the crop, give it a sugar, aspirate out the crop contents, pop it on a slide, and away we go hunting for Trichomonas, and if it's there, we can see it. So I guess for me, the step forward for these acute Trichomonas cases that are going to die very quickly is I use a metronidazole suspension for this. This is a suspension that holds its stability. You can directly crop feed. It tastes horrible. Add it into some of that rearing food, or else they will try and vomit it back out. But for me, this is a lifesaver for these acute Trichomonas birds. And putting it in water just doesn't cut it. It doesn't get in there quick enough at the concentration you need to combat an acute Trichomonas case. No, okay, if you're looking at in-water treatment here, and okay, well, I've put Doxycycline on the left here, I put Ronivet S here again, which is another Vetafarm product on the right, which obviously is a ranitazole that we would be using. You know, if you are going to give it in water, with any of these, when you've got acute situations, if this is the only product you've got, there's nothing to stop you for any circumstances of what concentration has it got for me to actually be able to use it. So just to recap, because recording stored then for a minute, you need to make sure you're getting the right dose in the water for budgies, which is 100 mg per litre. And again, this is the amount of active product. You must work out, depending on the percentage of product you've got, how concentrated the powder is that you've got. And because there's so many on the market, you cannot just buy ranitidine and go, oh, I'll just dose it at this rate. It's going to vary depending on the product that you've got. And you've got products out there that are 5%, 6%, 10%, 12%, 20%, all over the shop. And you've got to work out which one you need. And like I say, overdosing of these guys is a cause of toxicity. Those of you that are quite aged, like me, who have been keeping budgies for a long time, I had outbreaks of people that were dosing with other products from this drug class at that time in the water, and they were feeding it during the peak summer, or they were feeding it to breeding birds. And we're having mass mortality from neurological toxicity from these products. And ranitidine does cause neurological toxicity. It's the same drug class, it does the same toxicity. Maybe the margin between effective treatment and death is much wider than some of the previous products, which is why this is the one I would recommend, but it's still a risk factor. I'm then going to put another one on here for you, and we're going to have good old bait draw here, where we're seeing birds with enteritis. And I'm putting this in here as a little separate little thing really on here, because we get a lot of this in weanling birds that are going through a heavy molt, where you might get an enteritis, where we're making the assumption you've got a bacterial infection causing an issue for these. And most people, rightly or wrongly, would be reaching for enrofloxacin for these guys. That's great. If you're going to give enrofloxacin to them, then you can get, again, variety of brand names here, from Bactriol through EnroCare. Some of the online ones are not 25 mg per mil, they're 100 mg per mil. So you've got to work out your dosing. But this can be directly crop fed as well into birds that have a runny bottom, and that's, a lot of people would use that as targeted treatment for that sick bird, probably one that's in your hospital cage or in the warm, being crop fed as well. I'm going to do a little bit on Budgerigar fledgling disease, but I suspect you guys are far more acutely up to speed with this than maybe other countries, just simply because of having endemic disease in your native citizens, which obviously, apart from the African ringnecks that have escaped and have managed to colonize in London, we don't really have any citizens in the UK. What I would say really with this, when it originally sort of came out, there was this whole differences in presentations between countries. We see these presentations worldwide now. Everybody has a similar presentation. And you're starting off with French molt, Budgerigar fledgling disease, which for me, they are the same difference, and you're getting this sort of style in birds. Going through to the other extreme, where you're getting poorly performing chicks in the nest. Some of these will be going anemic, perhaps, showing a different presentation, where you're getting death at a young age, when apparently other siblings are like, yep, we're fine, we're not a problem. But I guess this is a sort of thing that you're going to be seeing coming through in your birds, or maybe you're going to be pitching over into a more classical sort of bird here again that's just got loss of all feathers completely. Now, the second virus that I need to sort of put at this point, and I guess this is where, again, having a vet helping you out is important. Citizen beak and feather disease, again, you've got native citizens, it's a complete nightmare. The reason I guess this is on the list here is we've got vertical transmission through the egg for beak and feather disease. Polyoma, much as it is possible, it's horizontal transmission from the mother in the nest box to infected chicks that then infect other chicks. And you cross-infect other chicks because you touch one nest and then you touch the nest next. Or you're fostering chicks between nests to try and save them, in essence. But I think there's lots of reasons that we inadvertently lie here. So this is a report come through from a fancier, which I'd done a couple of years back, and we've got positive for beak and feather disease. There's your diagnosis. We're negative for polyomavirus on PCR. Brilliant. But that was a lie. I'll tell you why it's a lie, because you don't always pick up your polyomavirus on PCR. And in fact, on post-mortem assessment of these birds, I have got avian gastric yeast. Yeah, okay, fine. I've got hepatic polyomavirus inclusions. This is hepatic polyomavirus as a cause for death here. This is systemic disease. It was negative on my PCR and PBFD was positive. But on the pathology of the bird, this is polyomavirus. You'll notice that I have taken the cloaca and skin down here, on the bottom here on the histo here, because if you've got beak and feather disease, you get classical inclusion bodies of beak and feather disease in the cloaca and skin. I don't have any. So I've got a PCR telling me it's positive. I've got no sign of what we call a host pathogenic response, if that makes sense. There's no suggestion in that host animal that that infection is causing any problems whatsoever. I'm negative on my polyomavirus, but I know you've got polyomavirus because your inclusion bodies are saying, I've got polyomavirus. There are studies, and this is 1995, look at this one, this is an old one here, looking at getting negative polyomavirus budgies out of positive polyomavirus budgies, which can be done. And in this case, this particular paper, they were resting the birds completely. They had all positive adults at the start, but they rested them completely, bred them for 2 years continuously after a period of rest. And these were adult birds, but they obviously were quite adult birds. These were 2, 3.5-year-old birds here they were looking at. So, you know, it was what I would suggest certainly for some of the exhibition style birds was considerably older than we would be utilizing for this particular study. The adults you're reading with would be considered young, but it shows, I guess, it's possible. So on some of the, I mean, I've also just done a brief summary of some of the diseases that we see for you, but obviously we've got to think about how we're going to control these. So again, this is just a little overview today, really. I mean, it's being brutally honest, the program that I'm in the process of developing, it would be a, gosh, you'd have to listen to me talk for probably at least 24 hours before I'd shut up. So this really is just a little snippet today. Your shed design obviously influences how you clean up. This is my dad's old shed. We were using wire cages at the time, wooden nest boxes on the side. But obviously, you know, you can empty most of this out for cleaning, which does help. And the first thing you've got to do is disinfect. You need, sorry, not disinfect, wrong word, getting older. You need detergents to clean everything first. Let's get it clean. And stuff, there might be things you use once a year that you create new every year, but we basically need to clean everything, and then I can disinfect, or then I can use antiparasitics. And the design obviously makes a difference there. So this actually is my dad's setup, not mine actually, but again, this is our UV tubes, and this is one of the reasons I use the wire cages. UV light diminishes with distance quite markedly. So the wire cages basically means my birds have enforced exposure to UVB on a daily basis, and we just have them running in strips between the banks of the cages. But for these can be cleaned out and done relatively easy. Now, this is a shot of my dad's bird shed that I'd scanned in, hence it looks a bit grainy. This would have been from gosh, I'm going to put this down. Actually, this was before we merged the two studs, actually. This is probably 1985, with a very high quality Budgerigar there you can see in cage number 6. This was at the time, my dad also used to breed clear wings as well at this time, actually. He was a big clear wing breeder, which obviously he went, but anyway, but nightmare. How can I clean these built-in wooden cages that are stuck in the shed? If I've got red mite between the corners of these cages, between the blocks of cages, in the nest boxes, in the dividers, in the trays, you can see how that sort of setup is a complete nightmare for red mite. Now, if we jump forward, this was the shed that Dad and I had. This will be back in 2006 now, where we went for plastic coated tin actually on the back. Still could get mites hiding between it, but much more wipeable and cleanable. We jump forward now to my setup now. And okay, it's not ideal because I hadn't really planned on taking the birds on. Obviously, I had a very short notice and it was like, so they've had a sort of a bit of a conversion. But I using wire cages still. And some of these are new, some of these are my dad's old wire cages. But basically, these come out. I dismantle them completely. They are power washed, used a detergent. They are cleaned, spotless. Having done that, they go and sit in a nice little plastic tub. They have a plastic tub with something for mites, if that's what you're doing, or a disinfectant, depending on the concentration and brand that you need and contact time that you need to be effective. They pop into here as spotlessly clean, or clean and dry, I should add. So these are spotlessly clean and dry. Pop in the disinfectant bath at the set concentration. You hit the timer for the contact time that you need, and the cage is just rotated through that. And when that cage comes out, it is clean. There is no question of that. It's had a disinfectant that's been effective against all of the infections I want to control it, and it's done. Do the same for the bird baths, do the same for the fountain and the dishes and drinkers. They can all run through this at the set time that you want. And to be honest, for me to disinfect everything coming out of my shed or everything going into my shed for breeding, it is normally 2 or 3 days worth of doing it. And I think the thing is when you're looking at disinfection to be effective, certainly against some of the more persistent diseases, which I haven't mentioned today, this has to be really concentrated. You do not want your birds to be inhaling this. You do not want your birds to be touching this stuff. And because you've got contact time, you have to kind of have your stuff soaking for 10 or 15 minutes. So if I've got one wire cage, I can do that in an hour in this disinfectant bath. But because it's a disinfectant bath, because everything that goes in it is clean and dry, I'm not contaminating that disinfectant bath with organic material. I'm not scrubbing it and it's spilling around or being lost. I've used one concentrated bath. Everything goes through that, if you like, for a set period. And that one concentrated bath will do everything from my bird shed in one bath of water. It's an incredibly effective, but also incredibly economic way of doing it. Whereas if you were scrubbing cages that are fixed in your bird room or scrubbing an aviary, how much stuff are you chucking around? How concentrated was it in the first place? How much contact time do you really have? This stuff can run through all of this completely and be completely effective. I can rinse it off afterwards because it's had its contact time, and I have a spotlessly clean set of cages. Nest boxes go through here as well. Show cages would go through here as well. Everything. The only thing that's left in my shed that I cannot disinfect is the walls and the ceiling and the floor. Everything else would go through this disinfectant bath. The aviaries are, okay, maybe not through the disinfectant bath. I can dismantle them completely. They're metal, I can take them apart. I can power wash them spotless. Most of it, to be honest, I can soak in the disinfectant bath. It will sort of sit in there. So I can clean up my environment pristine every time I wanted to, absolutely. Okay, ectoparasites. We've got an infected bird room, we have infected birds. If you've got a massive red mite problem, give up, stop breeding. Because until you've got this under control, your breeding season is not going to be great. You're going to be hitting the young birds and possibly causing quite significant mortality in those as well, so stop. What we do know that ivermectin has a high safety margin. There's been papers published, and again, this is why you need to look at the evidence that is there, evidence-based medicine, or following, fact-checking your information. Ivermectin does have a high safety margin. There's been some papers looking at using 10 times the amount that you should use with no effect either. I'm not saying you do that. What I'm saying is it's a wide safety margin. So use it, and it works and it's effective. But you do have to do the environment. And there's loads of permethrin-based washes you can get. Some marketed for birds, some marketed for poultry, some marketed for other species. And this is fine. If you want to use this to dip all your cages and nest boxes through, this is brilliant. Bear in mind, you've cleaned them first, you've scrubbed them first with a detergent, and then you've rinsed off that detergent, and then you've dried them. And now I'm going to stick them through a permethrin bath. Brilliant. Okay, for upgrades, we're probably going to be using combination products. And realistically here, we're going to be using things that contain permethrin, which kills the mites. You want piperonal butoxide, which basically increases the speed and rate of absorption of permethrin, allowing a greater kill effect with a less concentration of product. And then you've got the methoprene with a third component in here, which is what we call an IGR. It's an insect growth regulator that impacts on the growth of, basically stops them molting to form adult mites. So these products are, in advance of your standard permethrins because they hit them 3 ways. And that's where, products like the Avian insect liquidator is very popular. If we're looking at the viruses, we've got to think about polyoma virus and how I'm going to control that. And again, there's lots of papers looking at that. There's also lots of papers looking at circovirus. Okay, I put up a porcine one because I was running out of time and I just grabbed this one. But basically, Psittacosis beak and feather disease is a circovirus. So we want something that's going to kill circoviruses. Well, here's a paper looking at that, and you'll see some of these are checking out things like Vercon S, for example, and stuff like that, looking for it. Now, when you go through the literature, when you go through the genuine research into effectiveness, when we're looking at government-approved disinfectants against circovirus in pigs, for example, or tuberculosis, which I haven't mentioned today at all, really, but in cattle, we want something that has been proven to be effective. I'm not interested in some marketing hype from some bird company that's going to try and sell me their product. Show me the proof that this is the right one to use. Now, good thing here is well done bleach. Okay, bleach. And I'm not suggesting you use Harpic White and Shine. I'm not. This is just happened to be the bottle of bleach that I had sitting in the house at the time. Sodium hypochlorite is effective against Psittacosis beak and feather disease. It's effective against polyoma, and it's effective against avian tuberculosis, which again isn't mentioned today, but is a major issue in continental Europe and in the UK. But you need to, again, know the concentration of hypochlorite in your bleach. And then you've got to translate that back into, well, how much do I need? And then how much contact time do I need? And you'll see here, if we look at avian TB, which is the most resistant of the lot here, you've got to have a 0.5% solution of bleach over 10 minutes. So that means I take 1 ml of my normal household bleach, I add that to 3 ml of water. That's how concentrated it needs to be. And I've still got to soak everything in it for 10 minutes to kill off TB. Okay, so if you want to try and reduce the impact of these diseases and reduce transmission, this is the sort of setup you need to be doing. And obviously, we don't want thick bleaches you'd use down the toilet. We want thin bleaches, and you can get larger quantities of thin bleaches at higher concentration to use. We also don't want the birds exposed to this. This is very concentrated. This is, I'm doing it out in the fresh air, in my bath, dipping everything through, timing it, rinsing it all off. And then, okay, maybe I'm doing a light spray around the walls and stuff and decontaminating that way. But the nest boxes, the trays, the perches, the cages, all of my dishes, all of my drinkers, they've had a completely effective control of infection. And then the last thing I'm going to sort of cover for you really briefly is we've got to avoid introducing infectious disease. So when you're dealing with a large collection of birds, introducing disease is on your list. Do you want to risk a new infection? You don't want to get red mites and scaly face in. I can eliminate those. I just have to quarantine and treat accordingly. I probably would be treating ranitidazole as standard on arrival, because this is another endemic disease. We know that's one that we're going to have to treat. I'm going to treat while I'm doing that. And 2 weeks is probably fine for treatment, to be honest. And you can do that whilst they're in quarantine. And I probably would go for a 4-week period, and I probably would be looking at their weight and feeding and droppings and everything else on there. I probably wouldn't be treating for avian gastric yeast at that point, because again, my birds have already got it, as yours will. But I certainly would be wanting to eliminate the parasites before they come through, because I know I can do that. And if you're thinking that I've just bought this expensive bird, why would I put it in quarantine? Why would I sit and look at it? I need to breed with it. I want to breed with it now. That's fine. Because all you're going to do now is you're going to take the hen you're pairing that to and put her in quarantine as well. She can join that cockbud in quarantine, and they can breed in quarantine. And if you're that desperate and you're thinking, what if they don't rear? What am I going to do? Foster the eggs. Let that first hen with that cockbud in quarantine just lay a bunch of eggs and foster them as they're laid. There you go. Then when he's ready to be introduced into the main shed, why not give him a second hen? Give him a better hen now, because you know he's fertile, because you've got fertile eggs from the first hen. And that hen was spareable, I guess. Do you know what I mean? If there was something unpleasant, well, she's the cannon fodder that's gone in with him, and she's all right and he's all right, so I can move him in with the better birds now. So that was really what I wanted to say today. And like I say, as Chris said, and I think, like I say, the meeting that we've got today, this is exactly how it's going to be. As your numbers dwindle, if you want to get a speaker in and they're traveling a long distance, hell, they're 17 hours, it's going to take 17 hours for me to fly to see you. Well, you can do it on Zoom, but you can still have that in-meeting experience as you are. You can still have your raffle. You can still chat about, whatever, and have your lovely sandwiches. I've had to make myself a cup of tea and have a banana myself. Didn't get it provided by the host, did I? No, that's all right. I'm fine with that. I'm good with that. I've still got some left. Over to you, Chris, and we'll open the field out.